Biliary atresia causes, symptoms, and treatment. Biliary atresia is a rare disease that affects the bile ducts, causing a decrease in liver function and potentially leading to cirrhosis. Causes of biliary atresia. While the exact cause of biliary atresia is unknown, research suggests that it is a genetic disease caused by a gene defect. Specifically, causes of biliary atresia. Genetics research indicates that biliary atresia is inherited in an autosomal dominant pattern, meaning that if one parent carries the gene, their child has a chance of developing the disease. Causes of biliary atresia. Environmental factors. Several environmental factors are also thought to contribute to the risk of developing the disease, including exposure to toxic chemicals, medications used during pregnancy, maternal infections during pregnancy, poor dietary habits, exposure to toxic chemicals. Causes of biliary atresia. Medications used during pregnancy, maternal infections during pregnancy, poor dietary habits, exposure to toxic chemicals, medications used during pregnancy, maternal infections during pregnancy. Causes of biliary atresia. Poor dietary habits. Symptoms of biliary atresia. Biliary atresia is typically detected in newborns within the first few weeks of life. Classic symptoms include jaundice. The skin and whites of the eyes turn yellow due to bilirubin buildup in the blood. Symptoms of biliary atresia. Pale stools. Because bile is not secreted into the intestines, the stool is light-colored or white. Vomiting. Infants often vomit after feeding. Abdominal distension. The liver and spleen become enlarged, causing the abdomen to swell. Symptoms of biliary atresia. Failure to thrive. Babies are slow to grow, underweight, and malnourished due to poor absorption. Fever. Fever may occur due to bile duct infections. Itching. Bile buildup in the skin can cause itching. Diagnosis of biliary atresia. To diagnose biliary atresia, doctors will rely on clinical symptoms, along with additional tests. Blood tests. Liver function tests, bilirubin levels, and other indicators of liver function are measured. Liver ultrasound used to detect abnormalities in the liver and bile ducts. Diagnosis of biliary atresia. Liver biopsy. A sample of liver tissue is taken for histological examination. Endoscopic retrograde cholangiopancreatography (ERCP) allows for direct visualization of the bile ducts to determine the location of the blockage. Treatment of biliary atresia. Treatment for biliary atresia primarily focuses on alleviating symptoms, preserving liver function, and delaying disease progression. Medical treatment. Medications to reduce bilirubin levels and decrease jaundice. Antibiotics to treat infections. Diuretics to reduce fluid retention. High-calorie and high-protein diets to support nutrition. Maintaining oral hygiene to prevent infections. Surgical treatment. Bile duct reconstruction to overcome the blockage. Liver transplantation. This is the best option for severe cases, but it is associated with many complications and high costs. Important notes. Biliary atresia is a serious condition that can be fatal if not treated promptly. Treatment must be provided by a specialist in gastroenterology and hepatology. Families must strictly adhere to the doctor's instructions for treatment and care of their child. Prevention. Currently, there are no effective preventative measures for biliary atresia. However, families can be proactive in screening and monitoring their children's health, especially if there is a family history of the disease. Conclusion. Biliary atresia is a rare but potentially serious disease that can have a profound impact on a child's health. Early diagnosis and treatment are crucial for minimizing dangerous complications and improving the chances of survival.